we are going to be doing an interview with Miss Katie, and she's going to answer a few questions for us for Domestic Violence Awareness Month. So, welcome, Miss Katie.
Good morning. Thanks for having me.
This morning, could you start off with our interview by telling us a little bit about what you do, how long you've been there, and what your world looks like?
Sure, certainly. So again, my name is Katie Henningess. I work for Families First Counseling Services, and I have been with Families First going on 15 years now, and then been in the child welfare services for over 23 years. And I am the Eastern Regional Director as well as a junior partner here at Families First.
Awesome, awesome. So when you first started there, did you start off in that position or did you start off as a direct counselor?
I actually, when I first started, which seems odd looking back, but I first started in like a QA supervisor position, but we quickly learned that quality assurance and reading documentation is not one of my strong suits per se, and so rather I wanted to get back into the field and working with those who provide services to children and families, as I had done with other agencies previously before joining Families First Counseling. So I became a supervisor then of those who provided in-home services.
That is so awesome. So can you tell me exactly what it is that your program does in the community?
Yeah, definitely, be happy to. So Families First Counseling offers, we have a couple of different lines of services, for lack of better ways to put it. We have mental health counseling that we offer to adults and children, as well as we offer behavioral health intervention services to children. And we have, up in our northern kind of counties, we have the integrated health home that we provide to children as well and families. And then we also contract with the Iowa Department of Human Services for a contract that is now called Family Centered Services. And that contract was effective July 1st. And so it used to be called Family, which is funny, I'm almost forgetting the acronym already, which is good. FSRP Services is what it used to be called, Family Safety Risk and Permanency Services. And so we provide services to families to help them identify an underlying need or condition that led to a situation that placed one of the children in their homes in an unsafe environment or situation. And so we work with the family to identify that event and work on some action plans through what's called solution-based casework to help keep the children safe moving forward.
Awesome. So as a domestic violence advocate, if I have a survivor that comes to me and says they want BHIS services, would that have to be court ordered or can they get directly in contact with Families First?
So they can directly and voluntarily have mental health counseling or behavioral health intervention services through our agency. It's a voluntary service. And so there's a couple of different ways often that survivors or children and families may reach out to us. And one is some like to go to, with smartphones nowadays at our hands, a lot of individuals like to go to our website to look at our locations and get location information, which is www.families-first.net, or they may call our Waterloo office at 319-433-0395. Or we also have, for individuals, a 800 number too, as well. So that way, for those that may need some assistance with a toll-free number, and that's 1-888-316-3025. And so any of those methods, they can certainly contact us, and we even on our website have a referral form that if they fill that out, our office reaches back out to them as well. So.
Awesome. So can you tell me, have you ever heard of Helping Services for Youth and Families? And have you ever worked with our resource program with domestic violence advocates? And what did that collaboration look like?
Yes, actually I have. The neat thing is when I provided in-home services for, at the time it was called Bremen Lutheran services, then providing in-home, we actually worked with helping services frequently up in the Buchanan, Delaware, Winnesheek County, Aries, Fayette counties, because families were moving or whatnot in that area. And so our collaboration often consisted of, if the survivor was comfortable or thought it would be a good idea in our conversations, we would do release of information to ensure that we did have consent. And then we would talk with their advocate in regards to ensuring that we're supportive of the survivor and that we are working very collaboratively together so that we're not hindering or providing interventions that feel, that would punish, quote, the survivor. So definitely had lots of conversation on intervention, support, resources that we could help a survivor call, take the survivor to, things of that sort. So again, just making sure we're on the same page and being supportive.
Awesome. So if you had an important message to give someone experienced domestic violence, what would that look like? What would you say?
To a survivor, you're asking?
Mm-hmm.
That they're worth it. I think often with survivors, their self-worth has been minimized, crushed, or they don't feel worthy, for lack of better ways. And so once I had a survivor tell me that just knowing she has worth was empowering to know, and then being very supportive of that person no matter what the decision they make is. And so often in our work that or training that we have with our providers is we really want them to think about all the strengths they have, such as just a normal duty of getting children to school is a huge strength, because often perpetrators will take keys and keep them from taking the children to school or whatever that may be. So empowerment is something that we work very, very hard to ensure with survivors. We point out, even if it's a daily duty task that seems normal, it's a strength for someone who's in a domestic violence relationship.
I agree wholeheartedly. All right, so this is a pretty interesting question. So what are some things that you would encourage someone to do for self-care in your profession?
Self-care is definitely, I think, become a couple of words that we are trying very, very hard to ensure as we learn more about secondary trauma workers and those who work in this field and the impact that it has. We are working very hard on a lot of different levels for self-care. One is we've been providing trainings on what self-care means, as it sometimes means things different to different individuals, but helping individuals, even for example, take a walk just during the middle of the business day, just to clear their mind, get away from the computers, the phone, or whatever it may be. Just little tasks like that daily. But also ensuring too that there's even larger self-care, taking time and teaching even our employees to shut that brain off in regards to the work so that they truly can take care of themselves, focus on themselves and their children, their families, or whatever it may be, their fur babies, just whatever it is that they find comfort in as a healthy way to work in this field. And we're even now as an office trying a couple of pilots. One is that we are offering self-care days to our supervisors right now. So every quarter, it's not mandated, but we're asking them to take a self-care day. They do not have to put in paid time off for it. It's a bonus day, and we say it's just for you. And so we ask them, what are you going to do that day to take care of you? It could be, we always say Netflix and chill for the day. It could be petties. It could be read a book out on the porch, whatever it is, but something that they take care of them. And so we, even as an agency, are working to build in some things that help our employees do the same.
Awesome. And my last question is, what are some things that you would like to see happen out in the community to bring more awareness and sensitivity to domestic violence?
Yeah, this was a question I thought about. I don't know that I have a good answer, but I think about, just because I live in a rural community, often you don't hear about it, see it, but it's there. And so I think anything as far as speakers, posters, flyers. Actually, I happened to be recently at a gas station in a rural area and went to the restroom, and I seen the flyers up in the stalls, and I was just so excited to see that we had that, and there was human trafficking, domestic violence, and whatnot. And I was like, yep, perfect place to offer some resources. And so I think anything and everything to bring awareness is kind of what I decided was my best answer with that, because if it's out of sight, people don't think about it. And so I think anything can help bring awareness to communities in regards to what's happening.
Well, thank you so much, Miss Katie, for your time this morning. I really, really appreciate it, because I know you are a busy lady. And I always enjoy having a conversation with you. Yeah, and I always enjoy having a conversation with you. So I hope that we can collaborate and work together again soon.
Well, thank you for having me, and thank all of your advocates as well. They are a huge integral part of keeping children safe, so thank them all for us. I
sure will. You have a great day, Miss Katie.
Yeah, thank you. You too. Enjoy the weather.
I'll try.
All right, bye-bye.
Bye.